Hailings to all, and good night. So, tonight on Come Let Me Talk, we'll be talking to Mr. Dr. Shane Drates as we are speaking about the broad topic of athletic performance, but we'll be speaking about some subtopics within there. We'll be speaking about specifically what sports medicine is, what's athletic performance, and how those two intertwine and how they mix. We'll be also touching a bit on pre-screening for athletic performance, a bit on injury evaluation and how we address injuries, and we'll be talking about athletic event preparation as well. And of course, to everyone who is in the audience, feel absolutely free to make any comment, ask any question. I'm sure the goodly Dr. Drates will be willing to answer anything that comes his way. And you have a really good opportunity to have a very, very qualified young man here to answer any questions that you have tonight. So again, thank you very much for joining me, Dr. Drates. Thank you very much for being willing to share your expertise freely. And we will get this show on the road. Our runtime today is about 45 minutes or so. And of course, if you have any questions or not, or so, I'm sure that Dr. Drates will be willing to go a couple of minutes over time. But as for right now, come, let me talk. So, Dr. Drates, tell me a little about yourself, man. Tell the crew a little about yourself. I know you, but want to introduce yourself to the crew.
All right. First of all, I'm happy that you said young man. You might see some grays in your mustache and thing, but still young.
That's just wisdom.
Yeah, let me work with that. Yeah, so I graduated from medical school quite a while ago. I mean, I could say how long ago, 2006.
You can't be saying quite a while if we seem that we were just speaking as young.
Well, it's okay. It don't matter. So I went to UWI, and at that time, Barbados didn't have its own medical or full medical faculty at the time. So I would have done 3 years in Jamaica and 2 years in Barbados. I did internship at QEH and all that good stuff. And subsequently, I specialized in physical medicine and rehabilitation and did my subspecialty training in sports medicine at Montefiore Medical Center, which is in the Bronx, New York. And that is where I actually work now. You can say I have basically 3 roles. I will list them in terms of what I would see as the amount of time I spend on each. So I am the program director for the Sports Medicine Fellowship. So I was a sports medicine fellow once in this program, and now I am directing the education of others who want to become sports medicine specialists. I am also an attending physician in the Department of Rehabilitation Medicine, but my focus area is really sports medicine. So primarily outpatient clinics, doing evaluations, doing some injections, doing some ultrasound scans of different joints. And then the last post I would say is assistant professor of physical medicine and rehabilitation through the Albert Einstein College of Medicine, which is the medical school that the hospital is associated with. So
hello, right there?
Yeah, so if you see my if you see my email signature, it will have a few of those things on it.
You got alphabet behind it?
Startings of it.
Well, I appreciate the fact that with that wealth of knowledge there, again, that you were willing to share some of that with us. And the thing about it is, you're a very qualified young man, but yet you're a very down-to-earth fella, So I appreciate that about you, and we can delve deeper into this conversation. But before we get to some of the topics that we had lined up there, the subtopics, I just want to ask you, how was this transition here from obviously going through school and then practicing, exactly what you were learning there, the actual practicing element, to now educating the persons who will be coming after you? How has that transition been? Is it something that you enjoy?
Yes, it's something that I would say that I enjoy. I actually come from I don't want to say a line of teachers, but both my parents were teachers. And I always look and say, boy, teaching is it's serious work, you know, you need a lot of patience. There's a lot of after school or after hour stuff that you have to do, and that's my experience as well. But
Mm,
I I enjoy it. I definitely enjoy it. I like the fact that I'm able to share and pass on some of the knowledge and the skills with those who come after me. And I also help them to avoid making some of the mistakes that I made when I was training. I think learning by struggling and making mistakes is still good because I feel like those lessons stick with you longer. But
right, right.
um, if there was something that I really struggled with significantly when I was training, and I see them about to do the same thing, I'm like, all right, you don't need to do that. I went through that a few years ago, and I could tell you're gonna end up in problems. So just, you know, let's not
So,
let's not do that. Let's take a slightly different approach.
so that's where the gray hairs know the wisdom of the gray hairs usually come in here. No, I fully understand. No, I got the full circle. No. Lucinda wanted to know who's this boss that in here. I'm sure that she's referring to you, Dr. Dritz. And she asked me where you really going. Well, you can't expect that I here interviewing a big one and I can't really tell you anything, Lucinda. What do you mean? And I really get and I understand what you're speaking about with the teaching. We have at least one teacher. I saw coming in the host, Miss Hurley, and we had her doing her chat the other day, and I could fully understand, just all the rudiments. Well, understand from hearing all the rudiments that are involved with teaching. Plus, no, you're talking about teaching plus all the other things that you have to do. That's a lot. That's a lot. But I'm very glad that you're willing to pass on your information in that way and give the guidance and the nurturing that the youngsters will need.
Yeah,
So tell me
definitely.
something. Tell me something,
Hmm.
boss. We talking about we speak about medicine a lot, especially in this age that we're in now. But let me turn it into the sports medicine kind of things here now. And tell me what it really involved in physical medicine. One, and tell me what really involved in rehab two. And how
Okay,
your
so
specialty relates.
the specialty is really physical medicine and rehabilitation. That was my core specialty or base specialty. And this is a specialty, I would say, relatively new to Barbados and the English speaking Caribbean. Barbados didn't get one of those specialists until I think about 2006. And right now, I think there's just one, maybe two people who are there. And then you have one in Trinidad, one in Jamaica, one in Bahamas. So, if you talk about CARICOM, for instance, which is millions of people, you have like five for that for all of that, right? So it's really a field that's undersubscribed, but that is quite understandable because you don't get the um, introduction to that field in medical school in UE. I was able to get introduced to it because I had an interest. Somebody said something to me that sparked the interest, and then I was able to do an elective. So I actually came out here. I went to Mount Sinai when I was in my final year of medical school. From what I
Mm,
saw, it was like, all right, well, there's no other path to take, basically. But even up here as well, medical school, although the specialty has been around in the US for much longer, we're talking about late 1940s, because
mm,
it first came about for people to actually, rehabilitate a lot of people, veterans who came back from the wars, right?
right,
So remember, you would
right.
have you
Mm,
would have the First World War and the Second World War, which would have ended in 1945. So the
right.
specialty really blossomed after that. But despite that, and despite the fact that there have been about over 9,000 board certified physical medicine and rehabilitation specialists in the U.S., a lot of people still don't know what physical medicine and rehabilitation specialists actually do, and it's not something that all medical students get educated on. But if I had to sum it up in a sentence, I would say we are the specialty of function. So what we are concerned with is people who have diminished function or abnormal physical function, not mental, physical functioning. And this could be related to many different things. It could be something that is congenital, something you're born with, or something that came around the time of birth or not too long after birth. You're talking about things like cerebral palsy and those types of things, or something that you acquired later in life. And the spectrum of severity could range from things that are life altering, like strokes, traumatic brain injury, spinal cord injury, and those types of things, to things which are, a little less substantial, but for what we are talking about might be more relevant to our conversation. So if you pull a hamstring, you sprain your ankle, those types of things. So we have involvement over a broad spectrum of problems, and we within that, just like other doctors, you have orthopedists, you have OBGYNs, et cetera, then we have people that then subspecialize from within the specialty. So for instance, you have sports medicine, which I subspecialize in, which is quite popular. I would say the most popular one is pain medicine. So those are people that deal with chronic pain, and they do some spine injections and things like that. And then you have things like, traumatic brain injury, spinal cord injury, neuromuscular, pediatric rehab, and there's several others. So it's a really broad area, which I really think needs to be boosted in the Caribbean. We have to, we
I'm back.
Oh, yeah,
I'm
yeah, yeah,
back.
yeah,
I'm
yeah, yeah.
back. All right.
My channeling some John King from back in the day. Well
We
done.
got post and social commentary, OT box.
Right. So let me touch on sports medicine. Also, sports medicine, I think everybody thinks about. You deal with athletes who are injured. You're the man when somebody goes and you run onto the field, and that's how it started. But now it's branched out and also become quite broad. So you deal with different demographics. So yes, it's still the athletes that get injured, but it's also anybody who has some kind of musculoskeletal issue. So people with arthritis, middle age or older people that got rotator cuff injuries and foot problems and things like that. And the reason for that is because athletes, yes, are fitter than everybody else. They're probably more resilient than everybody else, but at the end of the day, it's the same anatomy, right? So
Yes.
whatever you can do to manage the athlete's anatomy, you can use in the general population as well.
So I have a question as it relates to that. But before I ask that question, um, Paul Garns, got you covered.
Mm-hmm.
Made the statement. It's good to hear young men doing some big things. So keep it going, Dr. Dritz. Keep it going. I want to ask the question: do you find, as it related to the injuries and the rates of injuries, you find that the rate of injuries are increasing, and this not just from the athletes or the persons who are playing sports?
Mm-hmm.
I speaking about the everyday person who might get to the gym and involved in some activity.
Um, I don't know if I would say it's increasing. I think during COVID, definitely, you were not getting as many acute injuries, and the reason for that would be because there's really no sports that were going on. A lot of people were inside the house, you know, had everything buckled down tight, 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 avoiding COVID as it should be.
Right.
So nobody was outside spraining their ankles and dropping off of things and stepping in potholes and all these things that would make them come in with problems. But
Okay.
we still see the same types of injuries coming into the clinic, but there was a definite drop off. Um, when COVID was first around. Although, we were not doing in-person visits and we were doing telemedicine for a bit, there was still less people in the clinic.
Well, you're raising a lot of key words here. So you touched on telemedicine there just now. How have you found your ability to work with telemedicine? Do you find is it something that you like?
I think for some people or for some situations, it can be useful. There are people where for them to come to the clinic, they have to take time off work. I mean, everybody has to do that, but for some people, it seems a bigger burden than others.
Right.
So for them, I'm like, okay, yes, let's try the telemedicine thing. But having said that, no, you need to clarify. When you do talk with telemedicine, there's telephone and there's video, right? So I think everybody prefers video, especially from a musculoskeletal standpoint. Video gives you so much more information because I could look at you and say, okay, you said your shoulder that hurts. Can you, take off your shirt and show me exactly where it is on your shoulder that hurt? And then I could have you, I could look at your shoulder from the front. I could have you position yourself so I could look from the back, from the side, and I could get more information from doing that. If you just talking to me over the phone, I have to ask a lot more questions because I can't see what is happening. And I have to give you much more precise instructions about what I want you to do. Again, because I can't see what you're doing, to give you feedback on, are you doing the right thing? And you can't see me, right? I can just demonstrate and say, yeah, put your hand up like this, right? So yeah, and then the other thing, which is kind of funny, and I also I have to kind of educate, the fellows and the residents who are not from the Caribbean, a lot of them from the U.S., grew up in the U.S. or born here or whatever. When you're talking to people from certain backgrounds and they tell you certain things, you have to delve a little bit deeper to make sure that you're on the same page. So this is your shoulder, right? We know that. But my grandmother or my older aunt or somebody like that might come to me and say, my hand hurts.
Yeah.
Right? So hand is for us, from shoulder down to fingernail. Whereas we say this is hand, right? In medicine. Yes. So if somebody comes and tells me over the phone, my hand hurts, and I will be thinking they mean this, but they may mean their shoulder. So if I go working that they mean this and they mean their shoulder, then it's not gonna work out because you're gonna make a wrong diagnosis, you can institute wrong treatment. Yeah, it's easy like that. Simple.
You gotta ask all the relevant questions before you get down to brass tacks.
Yes. You gotta make sure that you're on the right page. Everybody's on the same page. Another example is when people say that their hand feels numb, right? So when you tell me numb to me is you have less feeling or you have no feeling. So I always ask them, when you say numb, describe it another way, and you will be surprised how difficult it is for people to describe numb without using the word numb again. Right? But then when you probe, then they might tell you, oh, it's a cramp. Okay, it's a cramp. Okay, but that's not numb. That's not my understanding of numb. Right? So if you told me, oh, it gets numb, are you thinking, okay, you got a nerve problem, you gotta go for a nerve test, etc. Right? So now I'm going to subject you to a procedure that's uncomfortable, that you may not have needed because of what you told me. And if I did not have it in my mind that yes, I have to make sure we are absolutely on the right page, that's what can happen.
So we really here speaking about like screening per se, but as it relates to athletic performance, this is also something that we need to do, and in many cases, taking a step back and do pre-screening. What's your take on doing pre-screening for athletic ability or athletic performance rather? Also, when we speak about athletic performance, I'm also speaking of a person who is going into the gym for the first time or the first time after a little while.
Mhm. Yeah, so I mean, I think you definitely know that I am a big proponent of screening. We actually, I'm sure you remember this. We actually were discussing a project that we wanted to do.
Yes,
We went and
yes.
spoke to a big boy in the ministry at the time and all that, and we got some good feedback, and then things kind of
Haven't
fell
tried.
through,
Yeah.
right? But yeah, definitely, I am a big proponent of screening an athletes, and I think generally in Barbados, and I don't want to speak for the Caribbean in general, but I feel a lot of things that happen in Barbados probably happen in the region generally. In Barbados, the screening is usually really only done for people who are going to go and represent Barbados
Mm-hmm.
overseas, right? And that is fair to do that. I mean, those people definitely should be screened, but I think more people need to be screened. I think athletes
Yes.
of all abilities need to be screened, at all levels should be screened. And the other thing with that is that when they start screening them, the timing of the screening usually is not optimal. So, Commonwealth Games is 4 weeks from now, and we can screen these people today. Okay, that's a problem. Why is that a problem? Because, you are 23 years old, right? You don't usually go to a doctor, right? You've not been to a doctor since, I don't know, you were 18, you had to get some immunization for some reason to enter UE or something like that, right?
Mm-hmm.
Since then, you've not really been sick. You just get a little cold. You don't really go to a doctor, whatever the case is. So, we check you out. Somebody listen to you heart. Yeah, you heart sound funny though. You got a murmur. Anybody tell you got a murmur before? No. My mother never told me I got a murmur. The doctor never told me I got a murmur.
Was
Yeah,
a
though, but
murmur.
well, it's basically an abnormal heart sound, right? So
But
if I listen to people's hearts, you hear but like 1, 2 like that, right? And that should be a repeatable sound. Sometimes people will have an abnormal sound in there, right? So instead of hearing that distinctive 1, 2, you might hear whoosh, whoosh, like that, or you may hear other things,
mm-hmm.
right? So now the question is, where this murmur come from? Is this an innocent murmur, meaning it has no real clinical significance? You ain't getting dead because of it, or is this something serious and you need to be checked out thoroughly by a cardiologist and cleared, or you should not be participating in sports at all because you might drop down and die, and it has happened. I don't
Yes.
think I don't think we've had cases in Barbados that I can remember people died while playing sports, but it's happened in Jamaica, right?
Mm-hmm.
And it happens in other places. So
Furthermore, it also happens in places where screening actually happens to a very small degree, and that just shows how important it is to have the screening
exactly,
on a regular basis too.
yeah, exactly. So now if I find this murmur, I hear this murmur 4 weeks, 3 weeks, whatever, right? And I like, boy, I can't sign that paper and clear you. You need to go to a cardiologist, and the cardiologist gotta get some workup. So you say, okay, I can go to Doctor whoever, Doctor Ishmael, Doctor Massey, whoever. These people busy.
Mm-hmm.
Suppose if
Mm-hmm.
you suppose if you say, but you talk 4 weeks, but I can't see you till 6 weeks from now. So what gonna
Yeah,
happen?
exactly.
You know that. Well, you ain't going on that trip, right? So these are the things. Or let's say that they can see you, but then they need to do more workup. So you need to have enough time that if something is found, you can complete workup and get screened and get cleared, right? The other thing
Mm-hmm.
is somebody like you have an injury, and I examine you carrying this injury. But you should not really think with this injury. You need a course of rehabilitation, right? It's 4 weeks away, and you need like 6 weeks for the physical therapist to put you through the paces and say, yeah, you cool, you good. If you go there and run the 200, you ain't gonna pop your hamstring, those sort of things. But no, it's a time crunch, and we gotta left you home. And it's not your fault,
True
right?
that.
Because you were just following what the organization told you and set up for you, right? But these are the things that we have to put across to the big boys to let them know, yeah, this is how you need to do better for the athletes.
But we would love for our levels to go from here to here, but in some cases, unfortunately, we're not putting the things in place to systematically go from one area to the next, and that's a little bit unfortunate. All right, see that Dr. Drace has frozen, and I ain't sure if that's because of me or because of him. Maybe you guys can let me know if you can hear me at this point in time. Oh, Dr. Drace is
Yeah, you
back.
can hear me.
I can hear
Yeah, I
you.
think somebody was trying to call through or something. But
Oh,
yeah,
okay.
yeah. So I didn't catch what you were saying just now.
No, well, I was really just reiterating everything that you just said, basically, the importance. But I also
Hmm.
want to point out in there that when you say screening as a summary, when you say screening, it is both the physical screening as well as the medical screening. And I think that is such an important point. Just the other day, there was an NBA trade that happened. I'm not sure if you follow the NBA at this point in time, you're probably a little bit too busy. But Caris LeVert, he was traded to the Indiana Pacers from the Brooklyn Nets, and they actually found a tumor on his kidney. So that
Mm,
trade, because every time a trade takes place, they have to do a medical assessment, and that trade basically saved his life because he was screened right away so that he could join the Indiana Pacers, and it was right there that they found the tumor. And Caris was about the place running about an elite athletic level. You know what I mean? No
hmm.
tiredness, nothing. But that's what the screen found and saved his life. So that's why it's so important.
Right. Yeah, definitely.
Dr. Vaughn,
And the thing about it is that at those higher levels, they usually do more comprehensive screening. There's a lot of debate usually about when you screen athletes in the US and so on, do you do ECG on athletes, right? Um, and in the US they don't generally do ECG. In Europe, Italy, and so on, they generally do ECG. They generally want ECG done on athletes. The thing is about, the cost. Is the cost worth
is
it?
it worth it?
Right, and all these sort of things. But when you start getting the higher levels, people do ECG. Like if you for FIFA, I remember somebody was asking me part of a thing doing screening for, and this was at the youth level for FIFA. And these people not only wanted ECG, they wanted echocardiogram, which is basically
That's what
ultrasound of the
all the
heart,
way.
right?
Mm,
So at those higher levels, there's much they do a lot more. And when you talk professional, there's a lot is incentive from the team's standpoint to do things because they spend a lot of money on players.
mm,
So they really are on the ball with it. Interestingly enough, going back to the project that we had, you remember that we had a medical part, we had a general like MS, musculoskeletal evaluation part, and we had a part which was basically looking for injury risk, right?
yeah.
Things that might put you at higher risk of injury. Now,
Mm,
at that time, when I say the official, the pre-participation evaluation form that would have been ratified by about five five different specialty boards up here did not really recommend doing things like that. Subsequently, they have recommended the addition of tests that could evaluate for injury. So there's something called dynamic valgus, which is your knee going inwards like this,
Mm-hmm.
which in the literature and so on has been shown to be uh, possibly or significantly correlated with ladies getting things like ACL tears and other knee injuries. So they
Mm-hmm.
actually added that to the official form that is now ratified by those boards. So what we came up with was actually probably,
A heady thing.
as two fellas in Barbados doing this thing, was ahead of, the official thing that people had. So I
Mm-hmm.
found that interesting.
Indeed, indeed, and that is definitely something that we always look for when we are screening athletes before doing a training program. That same dynamic vagus, trying to
Right.
see how we can get around that first before we add any load to the movements. Now,
Correct.
Dr. Vaughn, physio care Barbados, she said that athletes need to be honest as well about the injuries that they have. And that's a very important point too, because there's not
Yeah.
everything you're fine.
Yeah, definitely. Yeah, that's definitely important. I think, there's what you can call a conflict of interest, really. That sports medicine people will encounter when dealing with athletes,
Mm,
and that is that um, your priority is not necessarily athlete's priority, right? What's athlete's priority? To be out there competing and to
mm,
keep competing. My priority, and sometimes athletes feel that my priority is to keep them out, but that's not true. My priority is to make sure that they are safe competing. So they should be competing, without any significant injury, significant decrease in function, or whatever the case is, right? So athlete may feel, man, I got this thing, and if I tell the doctor or I get the doctor, you can tell me don't run. But 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 that's probably the right thing. You probably should not be running, right?
yeah.
But so there's that conflict there, and I experienced this when I was in private practice in Barbados a few years ago. This athlete came. She was a top sprinter in the island. She was attending one of the powerhouse schools in St. Michael, right? And she came to me because she injured her hamstring like a month before, right? She was still competing at these Saturday meets and stuff like that, but she noted definitely her performance was down. She was still having pain and all this sort of thing. So I evaluated her. Definitely, she had some tenderness in the hamstring. Ultrasound was a big thing for me, so I did a little ultrasound in the office, scanned the area, and I saw this tear, right? So I told her, well, you basically need to rehab this, and I cannot encourage you to go and compete. And so, she came with her mother and she came with the coach, right?
Mm,
So there was this conversation. Well, she's a top schoolgirl sprinter in Barbados, man. She could probably run at 50% qualify for the finals. Now, I forgot to mention, this was the Monday she came to me, and the Tuesday was the zone sports for the zonal meet for inter-school sports. So
mm.
inter-school sports has changed from back when we were at school, and now the schools
Yes.
are divided into two zones. You have the zonal meet, and then everybody comes together for the big meet and the finals.
Mm.
So I mean, what is the end game? What is the thing about getting her into finals? Once you get in finals, you guaranteed a point, right? And that's basically all it could be,
So
But
you looking to
there
risk your hamstring for a point.
yeah, it was that kind of conversation. I just had to quickly nip that in the bud and say, no, this does not this, you can't do this. She was disappointed, but she went on. She got a athletic scholarship, and my understanding is that she's doing very well.
Excellent, excellent.
So you just have to you have to look past the short term sometimes, right? And look at the medium to long term, because she could have gone and done more damage, and then the scouts would be like, "Oh Lord, well you got a grade 3 hamstring tear, nah, though.
Yeah, done with
We
you.
ain't work,
Always keep going.
we ain't working with her. Try again next year. Something like that. And so it's really not worth it. And saying that is also to tell people, don't be hesitant about seeking attention when you have an injury, because you might be putting it off and putting it off and putting it off, and you might be still doing what you're doing. You might make it worse, and then you have a longer layoff than what you might have had if you had if you sought medical attention quickly. So I would say, if you notice that you have significantly decreased function after injury, right? You have pain that's persisting or swelling persisting for a long period of time, more than like a day or two, right? If you're struggling to walk, to do just, regular activities, then yeah, it doesn't make sense to say, oh, I can seek medical attention, next month or something like that. Just come early and get assessed, and you will probably be able to, you should be able to get to feel more comfortable faster and get back to what you want to do faster, rather than if you delay. So
You know,
that's what I would recommend.
that's an interesting point, and it reminds me of the conversation that we had a few weeks ago with Husani Sultan Brewster, when he spoke about when he had fractured. It was fractured or broke. Anyhow, he mashed his hand, and ended up getting to effects, and the hand didn't stop him from walking up, so he was fine. But
Right.
he had to end up seeking attention a few days after. So we have this theory, especially us, man. We got this theory that, what, man, I can see how I feel tomorrow, and then I can get checked out. And then tomorrow, you see the same thing. It's almost like tomorrow never comes. How do we actually break? Melissa saying she thinks that he actually broke it. How do we actually break this cycle where people always, have that tendency to put back and put back and put back, in a case like that, so that we can get persons to be evaluated quicker?
Well, I think it has to start with education, to let people know, there's really no benefit to just, saying, oh man, I can just shake it off.
Mm-hmm.
Um, that reminds me of that, of a quote from Captain America from one of the Avengers movies, where he says, if they hit you, hit back, and if you die, shake it off, right?
Shake this
so
off.
so is that so is that sort of thing. I think athletes as well have I don't want to say a bravado about it, right? Where people look at
Invincibility.
you like, yeah, like, what man, you finger the back and you still out there playing cricket and batting and thing. Man, he's a boss, man. He really come true for the team. And all these
Mm-hmm.
sort of things. And it really impacts on them seeking attention when they should. Um, even look back at the World Cups, football World Cups. I saw a man get knocked out in 2014, down on the ground, out, cold.
Mm-hmm.
And then the doctor basically, called for a sub, and the man said no, he going back in, which was absolute folly. The man had a concussion,
Indeed.
right? But this is the sort of bravado that athletes have, where it's like, man, I can put everything on the line, and in the heat of the moment, and based on what I said is their priority, they neglect to think about what are the medium to long term ramifications. But we definitely need to educate people that they need to seek attention early, so that you don't have to be about there struggling, with your shoulder hurting for a whole month. You're struggling to put on a shirt. You gotta ask your wife to wash your back. I mean, like that's not that's that might be romantic, but that's no way to live.
Not every day,
So
so.
exactly. So you have to you have to let them know, better can be done. I think sometimes people may think about the financial aspect in terms of, you man, I gotta see doctor, he can charge me whatever he can charge. But again, is your health, right? And
Yes, for that.
yeah, you wouldn't want a situation where because you left it, now you needed something more drastic in terms of treatment. So instead of just getting physical therapy early, maybe an injection, um, you know, you got a big rotator cuff tear, and you gotta go and see Dr. Critchlow or some other surgeon, and so now you gotta spend thousands of dollars instead of spending, couple hundred or whatever. Um, and you have a much longer layoff. So, those are the things that you have to kind of put it in context with people
It's true, buddy.
as well.
That is very true. At the end of the day, it's better to nip it in the bud, deal with it early. You can save yourself some money, some financial strain, but you can also save yourself the psychological strain because you may be able to get back to your activity much sooner if you go to
Right,
the advice of the persons who have studied years and years and years and gained so much experience in these fields. I have
right.
two questions that I really want to tackle here with you. When you
Mm-hmm,
spoke about speaking to the athlete and the athlete's bravado, we also have some situations where, because you mentioned with the athlete, she came with her coach and thing,
mm-hmm.
but you also got some situations where the stakes, if you will, may be much higher. So I follow football a bit, and I would hear some coaches talking about putting everything out there for the team. He ain't care if you got a slight injury or not. He just want to make sure that you leave everything you have out there for the team at that point in time. Because some of these athletes also struggle mentally with the fact that if they lose the place, they're gone. How,
Yeah.
how, how do you have that conversation or persons in your field? How you figure people will have that conversation when the coach saying, man, look, we need this player, that player got to play, but your advice is to say, man, look, they got to hold out. How is it with that?
Well, I haven't had to have that conversation that often, but I think in the professional world, it would be the same thing. People, the doctors or other sports medicine specialists will basically use their best judgment, right? Because it's a situation where you could be damned if you do and damned if you don't, right? Especially if we're talking about up here in the US, which is a very litigious society, right? So a mom might come and tell you, my doc, don't worry about that hamstring, man. I alright, don't I just give me little painkillers and I can be good. I sort out. All right. But guess what? You do that, right? And he goes out there and tears it. The man will turn around and sue you, the man will turn around and sue you. I know he's torn it as a worse injury. His place on the team or whatever is under more threat because he's gonna be out for a longer period of time.
So always
Right?
get back to the basics.
Right. So is a situation where you have to let the individual know, these are the consequences, right? These are potential consequences, and if you feel strongly enough, also let them know, all right, well, you could do this, but you can be doing it against my advice. You understand? And then you need to document that somewhere. That you had this conversation, you laid out you laid out all the possible consequences of this person doing this and doing that, and they decide to do it against your advice, and that might save you when the person decide to carry you court. That might save you, because you had the conversation and they do it against your advice. You basically tell them, well, okay, well, if you do this, I advise you strongly not to do it. And I documented that I advise you not to do it. If you do it, as you're saying, Barbie, it's all at you. You understand? So, so you need to approach it that way.
Yes, definitely. So you imagine that your main function is to protect these people, but yet they can turn around and stab you in the back. That's real hard to deal with. So you gotta be walking around with paper and pen at all times, so you can have a contract written up on the spot, so you can save yourself from litigation. But listen,
Yeah.
saying that this reminds me of an episode of Grey's Anatomy when the guy cut off his broken finger so he could play a game. No, that's another level, no.
Yeah. I mean, people have tried all sorts of things. Funny enough, I was given a lecture on ethics and legal issues in sports medicine recently, and so I try to find some cases to keep it engaging. And one of the cases I came across was, this is ethical, not legal necessarily, although it did have ramifications for all involved. In 2009, so in rugby, right, there's this thing where you could basically say, well, okay, after you exhaust your subs, you can only have a sub if there's a blood injury, right? So if you're bleeding from somewhere. So this team, they're in this big game, and beforehand, somebody on the team had bought this fake blood capsules, right? So they wanted to substitute this guy so that they could get a kicker on, so that they could probably kick for a goal and maybe win the game in the last few minutes of the game. So this guy had a blood capsule, put it in his mouth, ruptured it in his mouth, so now he's bleeding in the mouth, right? By his fake blood, right? Calls for sub. So as he's walking off the field, and this was shown later, he winked at his bench. Right? They didn't pick it up at the time, but I guess they saw it on replay footage. Immediately, the medical staff from the opposing team was saying, this looked fake. Let me see what happened here. The man ran down into the dressing room where his team doctor was, and they shut the door with the medical staff and the other team in hot pursuit.
Trying to get you.
Yeah, and so he's like, oh man, you tell the doctor you gotta do something to show that I got injury. Doctor under pressure took a mini scalpel or something, cut the inside of the man's lip. No, so much ethical issues there. Like, you could talk about this for a whole you could talk this for a whole hour. But what ended up happening was he got suspended for a few months.
Only?
Initially it was a year, but then he snitched many people, so they reduced the punishment. So the director of rugby, I think, whose idea it was to utilize these blood capsules, got suspended and then fired. The doctor who did it got suspended from the general medical council. So it's just all around bad idea, right?
But so this is a literal occasion where snitches get stitches. Anybody got a drum that you can put there? But no, that is highly ridiculous. It just shows that people will go to every single length in sports to get the W.
Yep. Definitely. So yeah, there's a lot of education that you have to do, and yeah, as you said, you have to save these people from themselves.
Yes.
But I think I think it helps when you get the trust and the buy-in of the coach and the management of the team, because athletes listen more to coaches than they listen to doctors.
But
So
that's
if
the
you
thing, you
get
know.
so if you
That's
get
the
the
thing.
coach on your side,
Mm-hmm.
the athlete gonna fall in line most of the time.
Mm. And that's the impression that I always get as well. The medical staff just there in the background, just scurrying about doing the thing. But at the end of the day, it's the coach that always has that say.
Yeah, yeah.
You know, so
Coaches will push for a lot of things, but I think you have to kind of get their trust as well and show them, yeah, you what you're about. It's not that you are trying to keep people out. You are trying to basically look after the safety and the well-being of the athlete. And if it's a team sport, the team as well, right?
yes. Yeah, boy. I mean, those are some interesting points there for sure. Just showing how important it is to keep your ethics above board at all times, every single time,
Hmm.
and don't let yourself drop your standards. I wanted to ask earlier if there was any time that you had to speak to an athlete where you felt, because of delivering this news, which is perceived as bad news at the time, where you felt, like, this is some hard news to deliver, or you really felt a sort of way. The impression that again is that you are sticking to the facts, you're sticking to the basics all the time, and you just going, you know what, this is the case, and that is it, But you ever had those feelings where you felt a sort of way delivering this news?
Yeah, yeah, definitely. Like the instance that I mentioned before, I definitely felt bad for her because into school is like probably second biggest thing on the athletic calendar for them. The bigger one
Mm-hmm.
would be crypto, right?
Mm-hmm.
Um, at least for our region. So for her, into school was a big thing, and she was looking forward to competing at into school. I can't remember. I can't remember if it was her last year or what. Um, right. So you always want to do that, but the thing about it is what I think makes it more palatable for them is obviously the way that you bring it across. So you have to put it across with empathy, right? And then when you have them involved in everything that you are doing, the whole evaluation, and speaking to them as you are doing it, that helps a lot. So, as I took her history, I was saying, oh, man, this is, this is tough because, you're having significant challenge with, just, things that are normally very easy and simple for you, right?
Right.
And you've know the drop off in your performance and all these types of things. When I examine her, again, you have direct tenderness right over that spot that's painful. Again, that's not really like a good sign. And then we did the ultrasound. I could show her, look, okay, this is your normal side, right, or the unaffected side, and then look at this side. If we look at the same area, you see this side, everything looks normal, and then this side you got a little hole right there. Like, that should not be like that. So when you kind of put all that information there to them, I think they kind of get an idea of what is coming, and then you basically have to explain, or basically tell them recommendations, explaining why, which would incorporate a lot of the stuff that you discussed before, and of course you try to deliver it in a very empathetic manner, and that usually helps.
So basically, everything that you are saying here is that everything comes back to education. Education, sharing that knowledge, trying to get people to understand why things are going to be done the way they are going to go, rather than just saying, look, this is what's going on, follow this here, and that's it. It all boils back down to education. And in some cases, they find that, some persons have that approach, some don't necessarily have that approach, from what I've seen. And where the education is lacking, that is where we have persons who, may put themselves in jeopardy after, and it's always important to ensure that we have persons fully understanding as to what they are going through. Because after all, it's their body. You know what I mean?
Yeah. Education and trust, I think, are the big things when you want people to really buy into what you are saying. The era of paternalism, that's a doctor telling you do X, and you unquestionably do X.
That
That
done.
era is that era is long over. This is the era, and it has been for several years, of patient autonomy. So the patient has the right to decide, even if you think it's a foolish decision, they have the right to decide what they want to do, and all you can do is share as much knowledge as you can, educate them as to why you make your recommendations, and then they kind of have to take it from there.
Indeed. So interestingly enough, when we were planning this, we were identifying the topics and the number of topics that we were going to speak about today. Dr. Dres, you asked me, wait, so you think that these are enough topics to get us to 45 minutes? But when you hear the show now, it
The
is
time
now
gone.
about 7:50. And there's one topic here which we were going to speak about, which was athletic event preparation. You know, we kind of touch
Right.
on it a little bit, but we didn't really delve into it. So I am thinking that topic might be big enough that might be something that we may have to put back and delve into another time. What say you?
Yeah. I think we could probably have another conversation where we look at athletic event preparation, because I think is enough. You can kind of talk around that, and maybe we can talk about some other things.
Yeah, man.
Um, if the time doesn't fly by again, like it did today.
And if that's the case, then we get a part three, Doc. We will get a part
Yeah,
three.
yeah, no problem here. No problem here.
Okay, excellent, man. Well, I am very happy that you were able to share your information with us today. I'm also happy that you would have taken some information, which, in some cases can be a little bit highfalutin, and brought it and presented it in a way that all of us could relate to. So I'm very happy about that, sir. And as I said, you're a very relatable person because I know the person before I know the doctor. So in other words, this is something that I expect. So thank you
All right.
very much for not even hesitating, not even thinking about hesitating to join this forum and help us to educate the masses, because as you said today, the theme here that I really got down here now is education. So as the more time that we can commit to doing that, then I think that we will be able to spread some information bit by bit, and hopefully it will circle and go around. So I will definitely be in touch with you to see how we can schedule another live. We have some comments coming in. Dave Marshall, man.
They've been crying.
Yeah, man. We have Becca 333 saying it was great. She loves the information. Melissa saying thanks for this one, guys. Great breakdown. Thanks for sharing from PhysioCare Barbados, Dr. Vaughn. I had a comment here that Dan Gorgon, Dan Gorgon is an ancient name. Well, Jeremy, you get called out. But yeah, man, thank you very much for joining in. Thanks for everyone who has been here live. You didn't have a lot of comments, a lot of questions today, Dr. Drakes. And I really think the reason why you didn't have a lot of questions is because you were very clear with the information that you presented. And again, I want to thank you for that. So big at yourself, Drakes. We will talk, and I will definitely put some information out as to when we will do this again. Adrian Gihens says very informative to my old tape ball friends on Sundays at Foundation. So we got the tape ball crew
Tape
reunited
ball
to some
crew.
degree.
Yep.
Yeah, and I'm really happy to see that, man. Big yourself, Adrian. So thank you, everyone. Thank you for joining in, and thank you to the persons who will be watching this later on as well. Some people indicated that they couldn't make the time, but they will definitely catch it later on. So thanks to everybody, and I wish everybody a fantastic night as usual. Blessings,
All right.
everybody.
Welcome to GFS. My name is Kurt, aka Clarky, the Movement Motivator, and the TLSG. Click on the right or the left previews to see more movement videos.